Selamat pagi kepada BACHELOR dan juga kawan-kawan. Jadi hari ini kumpulan 6 akan membentangkan proposal research bertajuk selamat pagi kepada Dr. Alias. Pada hari ini kami kumpulan 6 yang terdiri daripada saya sendiri bernama Donny Bin Kinansi, Michlonie Richie Christopher, Muhammad Nur Affan dan Timothy Ho Kasung akan membentangkan proposal research kami. Tajuk proposal research kami ialah The knowledge of healthcare personnel regarding 5-moment hand hygiene and its compliance in the Hemodialysis Unit at Queen Elizabeth Hospital, Sabah. Next. Okay. Introduction, background. Hand washing is a crucial component of patient safety for the avoidance of infections linked with healthcare. Healthcare workers' hands are the most common means by which illness related to the healthcare are spread from patient to patient and inside the hospital setting. The greatest approach for preventing the development of antibiotic resistance and reducing healthcare-associated infection, or HAIS, is hand clean lines. Although healthcare workers seldom adhere to it, lack of understanding about proper hand washing techniques has raised serious concern for human health, particularly with the possibility of contracting several infectious illnesses. This study is to determine knowledge and compliance with 5-moment hand hygiene of healthcare personnel. Hand hygiene is one of the most important global healthcare issues in order to prevent infection and the spread of antibiotic resistance in all settings, from modern healthcare system to primary healthcare facilities. It is from Ne et al. 2014. Despite the fact that hand washing is a simple procedure, some healthcare personnel are hesitant to follow the suggested hand hygiene procedure. A lack of proper knowledge, awareness, and attitude towards hand hygiene is connected with poor compliance of healthcare personnel in following prescribed hand hygiene measures. Problem statement. Healthcare worker hands are the primary means by which illness linked to healthcare are spread from one patient to another and throughout the hospital setting. The greatest way to prevent the spread of antibiotic resistance and to manage infection that are connected with healthcare worker is to practice good hand hygiene, yet most healthcare workers do not do this. Significance of the study. Hand hygiene plays an important role in the prevention of infection in patients. If healthcare workers do not comply with 5-moment hand hygiene, it will make the rate of infection among patients higher. Thus, this research is done to study the knowledge of healthcare workers and their compliance with it. The study will be extremely helpful in identifying knowledge gaps, negative attitudes, and bad habits to improve the future development of effective initiatives to encourage healthcare staff to wash their hands. Aim and objective. General, to study the knowledge of healthcare workers about 5-moment hand hygiene and its compliance in the Hemodialysis Unit at Hospital Queen Elizabeth, Sabah. Specific, to measure the level of knowledge of healthcare workers about the 5-moment hand hygiene. Second, to assess the implementation of healthcare worker of the 5-moment hand hygiene. And third, to evaluate the part that hand hygiene plays in preventing healthcare-associated infection.
Okay, saya Muhammad Affan and I will present to Dr. Alias regarding literature review. Okay, so the first literature review that I collected and I already studied is about the 5-moment theory, stated that healthcare professional should wash their hands before handling patients, after touching patients, before contacting the patient's surrounding, before executing any sterile or aseptic treatments, and after coming into contact with blood or other bodily fluids. This is by Sachs et al. 2007. So the research that has been done by Sachs et al. 2007 has already created a momentum for another research by also by WHO, and thus WHO has already come up with a guideline which is 5 moments for hand cleanliness or 5-moment hand hygiene. Okay, so thus the second literature review is by WHO 2009. So the phrase 5 moments for hand cleanliness refers to a crucial time during normal patient care procedures when hand hygiene is necessary to prevent the spread of infectious organisms through contact in healthcare settings. So this is by WHO 2009. Okay, another literature review by Karkar in 2018 stated that infection is the most common cause of hospitalization and the second biggest killer of hemodialysis patients after cardiovascular illness. So what I can understand with the research by Karkar in 2018 is usually the infection is caused by some procedures that has been made in the hospital. For example, we have our own very high rate of reinfection patient that has been undergo some certain procedures or surgical from the hospital. Usually most of them will come back to the hospital with a secondary infection due to a certain procedure. So that's why Karkar stated that infection is the most common cause of hospitalization. So meaning the patient will come back to the hospital being hospitalized because of the infection. And also is the second biggest killer of hemodialysis patient, because hemodialysis patient will be more prone to infection rather than the other patient, because they have been involving in hemodialysis for at least 3 times per week. So number 4, some research review from Hillier, and this is very new in 2020, just 2 years ago. So he stated that one of the most crucial and efficient ways to lower healthcare associated illness and patient cross-infection is through hand hygiene decontamination. This is by Hillier 2020. So as we can see, so it is hand hygiene is the most crucial part in cleanliness and also prevent the patient cross-infection, because we always use our hand to touch the patient. So if we didn't take care of our hand, we didn't clean our hand, we didn't sterilize our hand properly, then of course we will definitely bring a cross-infection to the patient. So that's why Hillier in 2020 stated that from their research. Okay, so the number 5 literature review, the use of efficient hand disinfection agent designed in a variety of types and forms, such as antimicrobial soaps and water-based or alcohol-based sanitizer, is the only factor that determines the efficacy of hand sanitization. So this research is by Jing, Pei, Bose, McCarthy, Tharmalingam, and Madeswaran in 2020.
So I will continue with the literature review. So the next one is the majority of nurses and also the nursing supervisors were familiar with good hand hygiene practices. So the equipment and also the hygiene standards were typically accessible, but the adherence to standards are also required according to availability near to the work area and also the role modeling. So this kind of research made by Emma Smith and also the Mensa in 2019. So the next is the training in sanitary hand washing processes and also the efficient hand washing techniques has also a favorable influence on nurses' knowledge level and also the hand washing behavior. So this one is also research from the Carrego and also Akin in 2018. So the last one is the causes for lower compliance with the hand washing guidelines may be connected to forgetting to wash one hands or just not knowing, and also not knowing the guidelines for the hand washing. So this one research made by Novak et al. In 2020. So the hypothesis for this research is the practice of hand hygiene will make the rate of infection lower. So according to the hypothesis, we have gathered a few literature review for this hypothesis. So the first one is the hand hygiene is now regarded as one of the most important elements of infection control activities. This is because enough scientific evidence support the observation that is properly implemented, and hand hygiene alone can significantly reduce the risk of cross-transmission of infection in healthcare facilities. So mostly the area that we focus now is the hemodialysis unit in Queen Elizabeth Hospital in Sabah. So, and also according to the Centers for Disease Control and Prevention, CDC, it's stated that the hand hygiene is the single most important practice in the reduction of the transmission of infection in the healthcare setting. So we totally agree that the hand hygiene alone can actually reduce the rate of infection in hemodialysis unit and also in other hospital settings.
Okay, I will continue with research methodology. Our research design is quantitative, non-experimental, and descriptive research. And the population in our research is 40 staff of hemodialysis unit, but we only select about 38 people, 38 staff who is working in the clinical area. So our method used to take the sampling is total sampling, and the exclusion of the sample is the healthcare worker who is in management area and who is not willing to participate, and also the staff who is on study or medical leave. And our research instrument will be a questionnaire, and because the reason we choose this instrument because it's practical and allow participants to maintain their anonymity. For the data collection, first of all, we getting faculty ethic and hospital permission before we continue our research, and consent to address participant about the interest in participating in this study. For the data analysis, all the data we collected will be entered into Microsoft Excel Office. Then it will exported to IBM SPSS and coded according to the data type lah. But there's also a limitation in this research. The first limitation is sluggish or non-existent network, and also the participant lateness in responding, as this we will conduct this research through online, use email. for the appendix, this is our Gantt chart, the approximate time frame of the research. We approximate about January to December.
Okay, this questionnaire about two sections, the section N and also the section B. So this is basically about the biographic data and also the knowledge of participant in the section B. So okay, this is the sample for the consent form, which will be distributed to the participant also. And also we have to encourage the participant that all information are private and also confidential. So this is the consent form for the participant before starting to answer the questionnaire.
Okay, so the proposed statistics that our team has taken over a sample of a graph that we collected from one of the literature review. So as you can see on the x-axis is the practice of hand hygiene percentage, and also on the y-axis is actually the month from January until December. So the blue line is the practice of the hand hygiene, and the orange color is the healthcare associated infection prevalence percentage. So we expected when we implement this study, when we do this study, so the percentage of healthcare associated infection will probably be lower down, and also the practice of the hand hygiene by the end of December will be 100%. That is our target. So basically what we are trying to do is we are trying to propose to them that please do more hand hygiene, please encourage more hand hygiene so that you can prevent the healthcare associated infection. So that's why our target in the orange color by the end of our data collection and also our research, the percentage will be lower down. Alright, so this is our reference, and with that, Dr. Alias from Team 6, I thank you.